A study released by the Pentagon finds there may be a link between drugs prescribed to treat attention deficit disorder and post-traumatic stress disorder among men and women in the military. Al Jazeera's Melissa Chan has more from San Francisco.
The sample size is pretty large. The Pentagon had access to information on 26,000 soldiers. These soldiers did not have PTSD at the start of the study. And over the course of the research period from 2001 to 2008, about 100 soldiers were prescribed drugs such as Adderall and Ritalin. Now, what the study seems to show is that those who were prescribed drugs to treat attention deficit problems were 5 times more likely to be diagnosed with PTSD. Sometimes these drugs were given to keep soldiers awake during long stretches of combat. But here's the thing to keep in mind, though. Correlation does not mean causation, and that's what the study couldn't really show. It couldn't show that the drugs caused PTSD. Researchers tried to control for a variety of things, socioeconomic, demographic, other health factors, but more research will be needed before any real conclusion can be made. As some doctors pointed out, the fact of the matter is that the majority of people diagnosed with PTSD did not ever take any medication such as Adderall or Ritalin. Melissa Chan, Al Jazeera.
And let's bring in Dr. David Newman, Director of Clinical Research at Mount Sinai Hospital. Thank you so much for joining us, Doctor. Now, as Melissa mentioned, researchers, they analyzed the data of nearly 26,000 service members. Do you think that there's enough information in that study gathered that can conclude that military personnel on ADHD ran a higher risk of PTSD?
Well, so it's an interesting study, and it's a massive study that they had been doing before 9/11. So it's a study that before post-traumatic stress disorder had become sort of a hot topic, they had been looking into this. And because it's such a massive and interesting study, I think everybody's looking at this one. But this is actually a sub-study of the original larger study. This is one little question that branched off that larger thing about who gets PTSD and who doesn't. And this little question actually was only able to cull off about 28,000 of a larger nearly 150,000. And when they did that, if you actually looked at only the people who had PTSD and then the people who had prescription stimulants and the crossover between the two, it was 20 people. So we're actually talking about a numerator that is tiny, a denominator that's large, 26,000 people, but a numerator that's so small, I think you really can't draw much in terms of conclusions.
Do you think that this study, does it prove anything?
No. No, it clearly doesn't prove anything definitively. It's not the kind of thing that you would change policy on. It is the kind of thing that would raise a question, and it would raise a question that we might want to ask more about and do a really good study that asks specifically questions about just stimulants and PTSD, and then does a very prospective, sort of rigorous version of this study much better, though.
So for the servicemen and women who are taking these medications, should they be concerned?
I think it's something to look at. I think everybody should probably look at whether or not these stimulant medications get you where you want to go, because any time you're taking a psychotropic medication and you are prone to psychiatric exposures like PTSD from the battlefield, you probably have to take a look at that and figure out whether you might be able to get out of the entire pharmacodynamic system. You know, maybe you don't want to be on any kind of medications if you can help it, but we don't know enough from this or any other studies about whether or not there's a real important link.
And that brings up the question, do you think that they're being misprescribed to some service members?
I think there's a general sense in the medical community that they are being overprescribed to everybody. And so because that's a general feeling that everybody has, I think it would be hard to say that there's not that problem probably in a military population as well. I don't know that it's any different in the military population, though.
And a recent report shed light this week on a black market drug. It's called Pentagon. That's allegedly being used by ISIL fighters in Syria and Iraq. And the drug is also said to increase focus. Now, what does that tell you?
So interesting, very interesting. This is an interesting drug. It's actually a combination of two different things. It's an amphetamine, the way we've heard about amphetamines before in the classic sense. They will increase your heart rate. They will increase your concentration. They will make you stay awake for longer. They also make you prone to hallucinations. They make you prone to psychosis and getting loopy. On the other hand, there's a combination here with a caffeine type of a derivative. So it's actually a combination of an amphetamine and a caffeine. So it probably pushes even farther along the don't go to sleep kind of a effect that you would see with any kind of a no dose or any kind of a commercial caffeine derivative.
And in your opinion, does it give you some sort of insight into the state of mind of some of these people?
Well, I think, it's not uncommon. Listen, even in professional sports, we see performance-enhancing drugs in the form of usually stimulants. And the degree to which this is something that everybody, I think, thinks of as a potential performance enhancer is telling, and it's interesting. It's probably not nearly the performance enhancer that most people think it is.
Yeah, we've heard the term superhuman powers.
Exactly. So, listen, there is certainly, when you get to toxic doses of certain amphetamines, when you get to very high doses, you can get to what look like superhuman kind of scenarios where people don't feel pain. When you get to those kind of, when you get to those levels, those are not people who can be controlled on a battlefield or anywhere else. So it's hard to imagine anybody who's in a position of authority or supervisory oversight looking at a battlefield group wanting them to be on these drugs. So if you get to that position where you're superhuman, you're also super out of control.
Very interesting. Thank you so much, Doctor, for your insight. Appreciate it.
Thank you.
And Stella.
I'm the leading state sponsor of terrorism.